Hello everyone, welcome to Yellow Pages Nursing. In today's video, we will be discussing about modified ALDRETE score. Before entering into the session, if you have not subscribed our channel, please subscribe our channel and do not forget to hit the bell icon to receive instant notification. The learning objectives we will be discussing in this video will be: what is modified ALDRETE score? What are the parameters of modified ALDRETE scoring? What are the uses of modified ALDRETE scoring? How to perform modified ALDRETE scoring? Let's get into the session. ALDRETE score is a standardized scoring system designed to assess a patient's readiness for discharge from the post-anesthesia care unit after surgery or a medical procedure involving anesthesia. It is also known as the post-anesthesia recovery scores. PARS. ALDRETE score will be useful to evaluate the patient's physiological status and readiness for discharge from the post-anesthesia care unit to a ward or unit or home. The original ALDRETE score was introduced in 1970 by George Antonio ALDRETE and is a modification of the Apgar score used in neonates, and it is developed before the invention of pulse oximetry. Later, by 1995, a modified ALDRETE scoring system was described. So, what are the parameters of modified ALDRETE scoring system? The ALDRETE score typically assesses the following 5 parameters. They are activity, respiration, circulation, consciousness, and oxygen saturation. Now, uses of ALDRETE scoring. Discharge readiness. The score helps to decide when a patient is ready for discharge from the post-anesthesia care unit to a ward or unit or home. Next is monitoring patient recovery. This ALDRETE scoring parameter is helpful to evaluate a patient's recovery during their stay in the post-anesthesia care unit. Next is identification of complications. It can assist in identifying any complications or issues that may require further intervention or monitoring. Next is standardized communication. By using a common scoring system, nurses can communicate the essential information about a patient's recovery status in a clear and consistent manner to the healthcare team. Now comes the scoring range. Each criterion is typically scored on a scale from 0 to 2 with a maximum total score of 10. Sum up the scores for each parameter to obtain the total modified ALDRETE score. Let's see them one by one. Observing activity. Ask the patient to move all 4 extremities on command and assess their ability to follow instructions. 2 points are given when patient can move all 4 extremities on command. 1 point is given when patient moves 2 extremities on command, and 0 point is given when patient is unable to move extremities on command. Next comes respiration. Observe the patient's breathing pattern, looking for signs of dyspnea or the need for respiratory support. 2 points are given when patient is able to breathe deeply and cough freely. 1 point is given when patient is dyspneic, that is, patient has difficulty breathing or limited breathing. 0 point is given when patient is apneic, that is, patient is not breathing or ventilator dependent. Next comes circulation. Measure the patient's blood pressure and compare it to the pre-anesthesia level. 2 points are given when BP is plus or minus 20 mmHg of preoperative value. 1 point is given when BP is plus or minus 20 to 50 mm of Hg of preoperative value, and 0 point is given when blood pressure is plus or minus 50 mmHg of preoperative value. Next comes consciousness. Check the conscious level of the patient. 2 points are given when patient is fully awake. 1 point is given when patient is arousable on calling, and 0 point is given when patient is not responding. Next, oxygen saturation. Check the saturation level of the patient. 2 points are given when SpO2 is greater than 92% on room air. 1 point is given when patient needs supplemental oxygen to maintain SpO2 greater than 90%, and 0 point is given when SpO2 is less than 90% despite supplemental oxygen. Now, when the score is 9 or more than 9, this indicates patient is in a stable condition with a high level of recovery. The patient is likely ready for discharge from the post-anesthesia care unit, but healthcare providers should continue monitoring for any changes. If score is less than 9, further medical attention and interventions are required, and discharge may be delayed until the patient's condition improves. So far we have discussed what is modified ALDRETE score, what are the parameters of modified ALDRETE scoring, what are the uses of modified ALDRETE scoring, and how to perform modified ALDRETE scoring. If you find this video useful, please like it, share it, and subscribe it, and do not forget to hit the bell icon to receive instant notifications. Thanks for watching and have a nice day.